You are about to see a program about national health insurance. The United States, believe it or not, is the only industrialized nation in the world without some form of national health insurance. We believe that every American is entitled to quality health care as a matter of right. Congress has before it several national health proposals. We believe the only one that really makes sense and that Americans can afford is the one called health security. Under health security, no one will ever pay another doctor or hospital bill again. That is why we are calling the following presentation on health security Paid in Full. Now, here is my friend and colleague, E.G. Marshall, who will give you a clear picture of the national health situation in general and on the health security bill in particular. Thank you.
Have you ever tried to get hold of a doctor suddenly when you needed a doctor? Doctor, not 2 aspirin and a heating pad, or an ice bag and 1 aspirin, depending on whose family remedy you listen to last.
Hello. Can I please speak to Dr. Walters? Oh. This is his service? When will he be in? 2 weeks? No, I've got to see a doctor now. I'm pain. I hurt. Oh, who is he? Is he new in town? No. I can't hold on. I don't want an appointment. I want to see the doctor. Yes. All right. Thank you for your suggestion. You can't reach him. You can't reach him. Honey, get the car. The doctor's service says we ought to go to the emergency room at the hospital. Hope it's only indigestion.
Familiar? If you're lucky enough to have a hospital close enough, it is. All right. You've made it to the hospital without getting a ticket.
You single, married, divorced, separated?
Married.
What's your date of birth?
June 26, 1927.
Religion?
Really?
Do you have health insurance?
Look, I'm sick. Couldn't this wait until...
Sorry, I don't make the rules. Husband's income.
God's sake!
I know, but I don't make the forms either.
Whoever does make them really thinks up some Lulus.
Religion? Do you carry insurance? Own any real property? Employed? Employer's name and address? Bank accounts? Debts outstanding?
Demeaning, isn't it? The question is, are you a human being in pain, needing care, or are you some kind of property investment expected to be productive of profit to a medical care system? Let us leave aside for the moment that small but all-important word care, adequate care. Let us say your hospital stay is over. You're being discharged.
Sir?
Oh, it's okay. I've been discharged.
Yes, sir, but your bill.
Well, that's all taken care of, insurance.
Yes, but...
I gave you the card when I came in. Well, they wouldn't let me in without the damn card. It's all taken care of.
Yes, sir, but there are several items that aren't covered.
You must be joking.
No, sir. There's item 30979, $259, bilateral zero radiography.
What's this item? 90550, 295?
Well, that's the code number for anesthesiology.
I mean, that's not covered?
No, sir, not under your plan.
Well, what do I owe you?
It's $1,645.19. Sir? You all right, sir? Shall I call you a doctor?
No. I can't afford to be sick. I'd better call my son-in-law. Yes, I'll call my son-in-law.
Sir, would you mind using the payphone down the end of the hall, please?
I still got a dime left.
Not funny, not exaggerated, not atypical. a certain Mr. Sam Houston Johnson filed a plea of bankruptcy, declaring that nearly 2/3 of his unpaid debts were for medical treatment. "It is embarrassing to me," Mr. Johnson said, "to take bankruptcy. But it will be worth it if it points out to Congress that many millions of Americans are overwhelmed with medical costs they simply cannot afford."
So what's so embarrassing about that?
Mr. Johnson's brother was named Lyndon. And that is what this program is about, national health insurance. 40 million Americans have no medical coverage whatsoever. Another 65 million are only skimpily covered. We're the only industrialized country in the world without some form of national health insurance. We spend $104 billion a year on our national health distribution system, doctors, hospitals, insurance, out of the highest living standard in the world. And where do we stand regarding that word care, adequate care? Infant mortality.
17th. Even Hong Kong is healthier for babies.
Doctors.
In the suburbs, 1 for every 200 people. In the inner city, 1 for every 10,000.
Life expectancy for men.
22nd. East Germany is higher.
Life expectancy for women.
8th. Norway, Sweden, Denmark, all better.
We believe that health care is not a privilege of those who can afford it, but a right that cannot be made part of a profit system. We believe in national health insurance. How do other countries do it? Let's have a look at 3 other countries. What's it like living in a country with national health insurance? How do the nurses feel about it? The doctors, the people who deliver health care? But most importantly, how do the citizens of those countries feel about their national health insurance plans? Here are 3 gentlemen who've had personal experiences in 3 different countries. I'll introduce them by name now. Mr. Oscar Brand, Mr. Eric Goldman, Mr. Ed Lipton. Mr. Brand, what do you think of the Canadian health service?
I find, just as a matter of pure feeling of security, that when I walk across the border and know that I'm covered under one of the provincial plans, there's a great deal of weight off my shoulders, and that psychological weight is a tremendous nature. I'm much happier, healthier now in Canada at that subject.
Well, what happens when you become ill or have an accident in Canada? What's the first step?
Well, the first step, of course, is to get to a hospital or call a doctor. If you've been in one of the provinces, these are provincial systems, by the way. They're not all the same, though they're covered by grants and aid from the national government. Each province has its own system. If you've been in any province, established a residence for as much as 3 months, then you get, for the most part, without any payment at all, immediate care. And it doesn't make any difference what the care is. That's what counts. I know in the States, when I go into a hospital, I'm an outpatient, for instance. Just the other day, I fell off a stage in Washington. I banged both my knees. Had to go to a doctor. I knew I wasn't covered. I knew that unless I went into the hospital as a patient, that I wouldn't be covered. Of course, that pushes me, gives me the desire to get into a hospital, however, whether I'm sick enough or not, so I can get into a bed so my expenses will be paid. That's what happens in America under the system. In Canada, I don't mind going to a doctor 5 or 6 times to get cured. And that may sound like a wasteful business, but actually it isn't, because national health is tremendously important. I mean, not only from a psychological thing, but just from a pure standpoint of the government's costs in keeping people healthy.
Mr. Goldman, now you've lived, I understand you were born in Denmark and you've lived in Sweden, so you've lived in 2 different countries with national health plans.
The 2 health plans in Sweden and Denmark are not exactly alike, but they have this in common, that from your birth until the day that you die, you are covered, and you are well covered by the government through taxation of everybody. So you are helped very much by the fact that you actually, when you're working, living, and in your breadwinning years, you cover for your kids, you cover for the old in your country. And that, I find, is a very attractive way of sharing the wealth of your manhood and of the country that you live in. So I must say that having lived in both Denmark and Sweden with national health programs, I really can recommend that as a system worthwhile for the United States.
Now, Mrs. Thatcher, who was the head of the Conservative Party in Great Britain, came to this country and she was asked, suppose you one day become Prime Minister, as well you might, as leader of the Conservative Party, what would you do differently? And the first thing she said, we would not want to change the National Health Service. Now, that's a high recommendation coming from a conservative. Mr. Lippman, I understand that you had an incident while you were in Great Britain, although you're an American citizen. Would you tell us what happened?
Yes, I was studying at an exchange program school in Banbury, which is directly between Oxford and Stratford-upon-Avon in England. And I did a very dumb thing one night. I had a very critical accident. And at this point, I had been in England for about a month. I was sitting in a chair, and the chair went over, and worst came to worst, I punctured a hole under my arm, right in this area. And it was critical to the point where it was deep and it was dangerous because it's in the area of lymph nodes and very dangerous. I was immediately rushed to what is called a surgery, which is like an emergency clinic there, separated from a hospital. They said it was too serious, you have to go to the hospital. I went to the hospital and they didn't suture me. They said, we have to take you in for exploratory. I did. I was in the hospital from Wednesday night. I had surgery Wednesday night, medication from the minute I came in, approximately 8 o'clock Wednesday, till I left at 2 o'clock on Friday afternoon. And the entire charge for that whole 2 days and the following weeks afterwards, medication was 20 pence, prescription charge, which is approximately 48 cents.
Well, and that way, any person who is in Great Britain gets this treatment.
Right. I had a friend who had a tooth knocked out while he was there. We had a series of dumb accidents. And he was covered. He had all the oral surgery and dentist bills. Everything was covered. And that was also a very touchy situation for a while. It could have been serious, but it was saved.
Well, what were the people like in the hospital? How was the attendance there?
It was
the nurses
incredible.
And the doctors?
They were fantastic. They soothed me. They just really made me feel very at home, very much at home. They were all very outgoing to the point where no matter how serious your injury was, you always had a smile on your face when the sisters came into the ward. And I left that hospital and I went back subsequently every other week to visit and bring flowers to the nurses.
Well, Mr. Goldman, what personal experiences have you had that, with the health service, that is, with the treatment given in, say, Sweden?
Luckily, personally, I haven't had much of an experience. I'm quite a healthy person by nature. I have a family, and through childbirth, through the whole maternity process, and bringing up kids, I can only tell you that you get, in the Scandinavian countries, a very, very good service.
That's well baby care.
It is well baby care, absolutely. Nothing is left to the coincidence. You get a personal attendance from the doctors, from the nurses, and the fact that I've heard over here, how can you combine the big system with the personal attendance? I can only tell you, Mr. Marshall, that you can do it, and it is done over there. The difference in having a doctor maybe living on the next street from you, or in a doctor's house where 10 or 15 doctors do the same kind of a job, the difference is not so big when you have the fact that you know this is a doctor you're going to see.
Well, now, then there are no areas that are underserved by doctors in Sweden or Denmark.
Oh,
because
absolutely.
Underservice at the inner cities.
For example, in northern parts of Sweden, you have a problem. But I tend to believe the problem would be even bigger if we didn't have a national health service system in Sweden. Up there where you have, there are very few cities and people are living far apart. There, the government, through the National Health Service Program, can actually attract doctors, even if the coverage up there might not be, under normal circumstances, to make a doctor financially capable of living up there. Through coverage by, through the fact that he is, to a certain extent, remunerated by the government, makes it possible to put the doctors up even if in the lesser populated areas.
Well,
I think that must go for Canada too.
I would think so. Not in Canada. How is it affected
That's
there?
exactly what happened in Canada. Ordinarily, of course, doctors would be moving away, as they're human beings, from the poor areas, from the less sparsely situated areas, upper Alberta, Saskatchewan, out in the Maritimes, where things are very bad. But Once the health program came in '68 for the general populace, what happened is it kind of became an evening. Many doctors were able to work in these areas because people who ordinarily couldn't pay were now able to be supported through the government system. And so there is less of the problem of being under-doctored in many areas of Canada. It's done a tremendous amount for spreading out the number of doctors. Otherwise, they all would have been in Toronto, in Sault Ste. Marie, in Winnipeg, in Alberta, in
so
Regina,
the health service provided incentives for doctors to go to these underserved areas.
Yes, it also meant, for instance, that many patients who are poor patients, for instance, who ordinarily wouldn't have gone to doctors with their ailments because they were afraid of the costs, they didn't have the money, they're able to go and therefore to pay and therefore to support doctors in the area. It has made a tremendous difference. I don't know the statistics exactly, but there was a newspaper article just in the Toronto Star recently that pointed out that one of the areas in Newfoundland, which had almost had one doctor, say, for about 2,000 to 3,000 people, now had there was a doctor for every 500 to 600.
Mr. Lippman, have you had any experience in this country? Now that you're an American, you had a great experience in Britain with the health service. Have you ever had an experience here that you could tell us about in this country?
Well, I would think the only thing that would really relate is when I came back, I was ill with a bronchitis problem, and the bills were exorbitant.
Just for a bad cold?
Just for a bad cold, for cough medicine and antibiotics and antihistamines. It was just astounding. And I was so used to just walking in and paying my 48 cents and getting everything that I needed. And when the delivery boy came, it just knocked me over when he handed me all these big numbers.
That shows what the people who have experienced what the health care is like in some European countries might lead us to believe that it would be a good thing for this country. It's safe to say that we're going to have some form of national health insurance in America, and that some sort of measure will be enacted in this Congress, the 94th.
Well, yes, but the only trouble is that people are confused. The papers don't give it much play, and when they do, it's also confusing.
Well, there are really only two proposals you have to know about.
Okay, what's yours?
It's called health security. In the House of Representatives, it is bill number H.R. 21. In the Senate, it's S3. It's also called the Kennedy-Corman bill.
What's the other one?
It's the bill introduced last year by the Ford administration, and before that by the Nixon administration. It's representative of similar bills supported by the private insurance industry. The American Medical Association proposal introduced this year is almost a carbon copy of that Nixon-Ford bill, which is also known as CHIP.
Well, what's the difference between CHIP and health security?
The biggest difference is the fact that CHIP and all the other proposals except health security use the private insurance companies as carriers. This means that medical insurance will remain a multi-billion-dollar profit-making venture if any of them are passed by Congress.
And what else is different?
Well, let's assume a plan like CHIP is now in effect. Let's see your hospital bill. If CHIP were in effect, this item, you would have to pay for it.
That's $150 deductible, just like my automobile collision policy. Well, that means that I'd have to get sick $150 worth before they'd pay anything under CHIP.
Right. Now look at your bill. Even after you paid the $150 deductible, you would still pay 25% of the rest of the bill under CHIP. That's called co-insurance.
And under CHIP, I'd have to pay for a checkup, so I really can't afford preventive health care. And I'd have to pay for the kids' shots, too, right?
Absolutely. And there are other differences between CHIP and health security. Only health security is designed to provide full and adequate cost controls on the health care delivery system. Only health security provides for strict quality control. Only health security covers everyone, rich or poor, when you're working, laid off, or out of work altogether. CHIP, on the other hand, will allow doctors and hospitals to continue to charge patients more than their insurance covers. No wonder the AMA likes this so much. And there are no new quality controls under CHIP, only the same tired system that has created the malpractice crisis and other health care problems. Only health security covers every living American with those three little words.
Paid in full.
Paid in full.
Paid in full.
But somehow we're going to have to pay for health security. Can we afford it?
Of course we can. Look at it this way. In 1974, we Americans paid $104 billion for health care. We actually paid that much. And in 1975, we're going to pay over $125 billion because of double-digit inflation in medical costs. Health security will cost less, not more. But under health security, we're going to pay for health care in a different way. We will pay 1/2 of the cost by a 1% payroll deduction on income up to $21,000, which is what we are already paying for Medicare alone. And employers will pay a payroll tax of 3.5%, which is less than most of them are paying now under expensive private plans. The second half of the cost of health security will come from general revenues.
In other words, if I earn, say, $15,000 per year, 1%, that's $150 per year. Now, if I pay that, my medical care expenses will be paid in full?
Paid in full.
And if you don't make all that much?
You mean if you're poor? If your children are among the 40% who haven't had vaccines against diphtheria, smallpox, polio, because you can't afford it. If you can't afford preventive medicine, so you can't go for care until you get sick, and then you can't afford it. If you live where doctors won't practice because they can do better in affluent areas, if you belong in that group of Americans who have twice as much illness, 5 times the eye defects, 3 times the heart disease, 5 times the mental retardation, compared to the rest of us, if in short, you are poor.
Still paid in full.
Paid in full. It is, we hold, your inalienable right. We cannot afford to let the so-called private sector take over national health insurance, and with it, the inalienable right of every American to universal and comprehensive health care at a price we can all afford to pay. We hold, in this time of re-examination of our national origins, that to the rights of life, liberty, and the pursuit of happiness, there must be added the precious right to health. We are opposed once and for all time to the idea that health care is a privilege which the individual must be willing to pay for, but which he must forego if he cannot pay, then to be thrown with his family on the mercy of a profit system and hope that in its infinite compassion and mercy, it will take care of him. Yes, we believe that health care is a right and that only the federal government has the mandate and must have the authority, properly and adequately, to guarantee that right to all citizens. Of all the measures now before the Congress, only health security calls for such federal funding and administration.
I can't wait.
None of us wants to wait any longer for a decent, comprehensive health insurance bill to be passed here in the United States. But we can't just sit back and wait. We have to do something about it, and right now, without one more lost second. We're going to show you now how you can help make health security the law of the land and have all your doctors and hospital bills paid in full.
And he's talking about health security, the kind we need desperately in this country and we haven't got yet.
Yes, because if anything is basic, I think, to the rights of human beings, you know, you think of the pursuit of life, liberty, and happiness. Inherent in the pursuit of happiness, surely, is the pursuit of good health.
Exactly, and that's a right, not a privilege.
Yes.
But in order to get that, you know, it's going to take the combined efforts of all of us, you, me, and everybody out there in America, to let Congress know how we feel. Now, polls have been taken, and a majority of Americans have gone clearly on record favoring the kind of health security bill which is coming up in Congress now. But that's not enough. The polls will not do it. What? We have to write. We have to call.
We have to write to our congressman.
Anybody's congressman.
Yes.
Let him know we insist on having a health security bill passed in this session.
What is the attitude of Congress toward health security?
Well, I think Congress is positive in its attitude towards it, but Congress is under many pressures, and we have to get in there and let them know that the majority of us will insist on the kind of bill that really serves our purposes, that really treats our rights as rights, not as privileges. There was a gentleman from the insurance industry who was being questioned by Congress at the end of the last session, and they asked him, do you believe that health care is a right of all citizens? And he said, yes, absolutely, as long as they can pay for it, you know, which is hardly what we're talking about.
We all know that no bill ever gets passed by Congress unless there is strong backing for it from all of us here in the cities and towns of the country. So please call, write, or wire your congressmen and senators right away and tell them you want them to vote for Senator Kennedy's health security bill. If you can, call on them in person with lots of your friends. Our country needs health security now. Good luck, E.G.